Fellow Nigerians and friends around the world, compliments of the season. The last few weeks proved consequential for our determined effort to actualize His Excellency President Bola Ahmed Tinubu's resolute commitment in transforming the health sector from a consumption-driven model to one that creates jobs, enhances economic value, and strengthens our domestic manufacturing capacity, as well as improving the productivity of our economy overall. In October 2023, Mr. President established the Presidential Initiative to Unlock the Healthcare Value Chain, termed PVAC, and appointed a distinguished, renowned Nigerian, Dr. Abdul Mukhtar, who came back from the African Development Bank, to be the national coordinator of the program. The PVAC initiative was established specifically with a mandate to increase local manufacturing of pharmaceutical products in Nigeria to at least 70% of what we consume by 2030, to increase the total direct full-time employees working in the life sciences manufacturing subsector to at least 50,000 from the current estimated workforce of approximately 20,000, and to establish at least 2 commercially viable plants to manufacture biologicals across the health sector, for example, vaccine or similar commodities, and to establish at least 5 medical supplies, pharmaceuticals, and diagnostic plants in our country over time, so as to double Nigeria's pharmaceutical market share in Africa to at least 15%. I am very pleased to report to you that since the historic establishment of this initiative, we have achieved critical milestones. In June, His Excellency President Bola Ahmed Tinubu signed an executive order into effect, which was aimed at stimulating the domestic manufacturing of pharmaceuticals, test kits, medical textiles, and consumables. The order equally incorporates market-shaping interventions to enable government procurement to prioritize local manufacturers, an unprecedented step by an African country. While it is right to acknowledge that some initial implementation challenges have occurred, they have now been addressed collaboratively with all the key stakeholders. I'm also pleased to know that this policy is now positioned to deliver on its intended objectives. To date, we have secured line of sight to significant investments over time from the European Investment Bank financing mechanism, in addition to signing a $1 billion MOU with the Afro-Exim Bank for a financing mechanism to support incoming manufacturers and domestic manufacturers in the health and life sciences sectors. The diligent and effective work of PVAC under its indefatigable coordinator, Dr. Abdul Mukhtar, and his team has already inspired 5 development finance institutions, as in addition to the ones I mentioned above, to advance cooperation now among themselves and with us on new dedicated financing platform to support this effort to unlock Nigeria's healthcare value chain. Additionally, over 70 new healthcare manufacturing companies with strong projects backed by impressive business cases have already lined up, with 22 large-scale projects currently in active discussions with international financiers. More than 10 value chain verticals are being established in-country, including the manufacturing of rapid diagnostic test kits, which is exemplified by our signing of an MOU with South Africa-based Abbott Diagnostics, and also Colexa Codex, which is already manufacturing in Lagos. Abbott has agreed to establish a plant in our country that will manufacture rapid kits for malaria and several other diseases. Medical oxygen is another investment vertical being advanced, as seen in our partnership with the Global Gases Group, which is establishing a cryogenic air separation plant in Nigeria, and other supply chain support solutions, such as our recent agreement with Siemens Healthineers, a world-renowned company, to establishing an ultrasound assembly plant in our country. Active pharmaceutical ingredients is another important area of our sectoral investment focus, which is why I personally commissioned the Beta Lactam facility in Lagos State only a few days ago. Established by Jawa Investments, this landmark facility brings us closer to self-sufficiency in producing essential antibiotics like amoxicillin clavulanic acid locally, which is called augmenting under another company, ensuring supply chain security but also reducing costs for consumers, particularly the most vulnerable populations. Over 700 young Nigerians have already secured quality employment through the Jawa facility, directly contributing to household incomes and lifting up their communities. This is the economic and social impact of medical industrialization in action. Job creation, retained earnings, increased production capacity that can serve Nigeria and the African continent. Other areas of intensive effort in the health sector value localization include production of vaccines using live attenuated platinum mRNA vaccines, which are a long way in coming, but we are making steady progress over the long haul so that Nigeria one day will manufacture those vaccines. In addition, long-lasting insecticidal nets, nutritional supplements, reproductive health commodities, maternal, newborn, and child health solutions, as well as commodities for non-communicable diseases like hypertension, diabetes that we can produce in our country, even if we rely on importing others produced elsewhere that we are not able to produce by ourselves. This will take time, but we have started this journey. As we embark on this important journey for the sustainable growth of our nation's economy and enhancement of the welfare of our people, regulators such as NAFDAC and the Pharmacy Council of Nigeria have already been tasked with enhancing efficiency and effectiveness in their operations. Our goal is to ensure a regulatory environment that is robust, facilitative, one that encourages local industry to thrive without undue constraints, and allow us to trade with other countries for products that we are not able to produce ourselves. And today we are now beginning to witness tangible outcomes from these efforts. For too long, Nigeria had relied heavily on imports for even the most basic healthcare commodities. As we advance, this government's commitment remains very clear. We will continue to support the pharmaceutical industry through policies that promote industrialization, job creation, and economic growth, without necessarily limiting our ability to trade with other nations in our continent and outside our continent. Before I conclude, we in the Federal Ministry of Health and Social Welfare celebrate a moment that captures the very essence of what public service means when it is rooted in purpose, driven by commitment, and focused on results. Servicom office in the presidency announced recently that our ministry had emerged as the recipient of 4 distinguished awards: a Special Recognition Award, the Most Innovative in the Team A category award, the Best Performing in Team A, and the Ultimate Overall Best Performing MDA Award. I was so pleased to receive these awards on behalf of the Ministry of Health and Social Welfare. This, for us, was more than an acknowledgement of our efforts. It was a declaration that our collective work, our systems and early results are making a real difference in the lives of our people. These awards are a symbol of unwavering commitment to excellence in service delivery and to the promise that we strive to fulfill every single day. The Special Recognition Award holds particular significance as it acknowledges the Ministry's sustained drive to connect government to citizens and to touch lives through quality service delivery in Nigeria. It is a validation of the processes we have strengthened, particularly through our sector-wide approach, the enabling catalyst that has aligned efforts across government, development partners, civil society, and other stakeholders to drive meaningful change, including with the private sector. When our leader, His Excellency President Bola Ahmed Tinubu, GCFR, declared on December 12, 2023, that health is back on the front burner of Nigeria's policy agenda, it was a charge to act, and we did. These awards are a testament to the dedication of all my colleagues in the Ministry of Health and Social Welfare. These recognitions challenge us to do even more, to innovate further, to perform better, and to deepen our collaboration with all key stakeholders to ensure that no Nigerian is left behind in our quest to deliver improved quality healthcare. We dedicate these awards to the people of Nigeria whom we serve and to the Commander-in-Chief who has provided us with the enablement to serve. Thank you, and I wish you all a happy holiday season.